Welcome to the post COVID 19 Interdisciplinary Clinical Care Network Education Series. This video is the third part of the series on mental health and COVID 19. As always, please remember that these educational modules do not replace a visit with your family doctor or healthcare professional. Remember to take your time to watch these modules. Aim to limit your screen time by watching just a little bit at a time. You're welcome to look at any videos as many times as you wish or need. Before we begin, we'd like to acknowledge that PHAC provides services to a diverse population, including First Nations, Inuit, and Métis people living in various settings and communities across BC. As a provincial network, we operate on the unceded traditional and ancestral lands of many Indigenous peoples. We wish to acknowledge with respect and gratitude all of the Indigenous nations, Inuit, and Métis communities with whom we live, work, and provide care. In this video, we are going to talk about stigma, prejudice, discrimination, and social isolation, and the impacts each can have on health, particularly for people recovering from COVID-19. You may have heard of or experienced stigma, prejudice, and discrimination against people who have the virus, people who have traveled recently, or people who have come in contact with someone who has the virus. According to the Center for Addiction and Mental Health, stigma is defined as a negative stereotype or negative association about people with an illness. For example, a negative thought about people with COVID-19. Prejudice is a negative stereotype about a group. For example, racism. Discrimination is an unfair treatment due to a person's identity, the things that make us individuals, such as race, age, gender, and sexual orientation, to name a few. When people use stigma and prejudice in their actions, it results in discrimination. Beyond the physical and mental impacts of COVID 19, some people and communities may be further impacted by stigma, prejudice, and discrimination. Statistics tell us that COVID 19 hospitalizations and deaths have affected Black, Indigenous, and people of color more so than other groups. How do we explain this? Some groups in particular, Indigenous, Black, LGBTQS+, and people of color, often have other chronic health problems that increase risk for COVID-19 illness. We also know there are many social factors that impact health and the result of healthcare. Other non-medical factors include things such as housing, the neighborhoods or settings, as well as conditions where we live and work, our level of income, education, immigration status, our ability to access healthy food, and adequate health care. Previous experiences of trauma resulting from violence in families, systemic violence or abuse, life threatening health conditions, or natural disasters, all of these factors are intertwined and influence our health risks and our ability to cope with them. Public perception can add to experiences of stigma and discrimination. When some groups have more people affected than other groups, this can impact how the public views these groups, fuels misinformation, can lead to isolation, and affect mental health. The cycle can be continuous. Experiencing illness and feeling that you don't have a voice in your care or an advocate that can help you find that voice also affects the path to recovery. Let's watch a video clip to understand how the pandemic led to different types of social stigma. Please see the links in the video description to access the video. Why is it important to understand stigma, prejudice, and discrimination? The answer is simple: because the effects are harmful to others. Stigma associated with COVID 19 could lead people to feel blamed and judged for having the virus, or guilty and shameful just because they got sick, or because others around them also became ill. It can lead to entire groups being misunderstood and not trusted. Stigma and prejudice separates people and increases risk of isolation. Being cut off from others during recovery can add to mental and emotional distress. It can also limit understanding of what someone who is sick is going through and the availability of help when needed. Fearing racial discrimination or mistreatment can also prevent some people from seeking help. Ultimately, the whole community suffers as well. Have you been affected by stigma or discrimination? Remember, it is not your fault. Anyone exposed to COVID 19 can get sick. The virus does not discriminate. Reach out to people who you trust, people who do not judge you for getting sick. Share your experience and feelings with them. Limit your reading of new articles and unreliable online posts, blogs, or Twitter that trigger distress. If you know someone who is affected by stigma or discrimination, be an ally and let them know you are there for them. Northern Health BC has created a great video on Indigenous people's stigma and COVID 19. You can access this video anytime by cutting and pasting this link into your browser. More resources are available in this video as well. Let's switch gears and discuss social isolation. Social isolation has been such a big factor in all of our lives since the beginning of the pandemic. There have been so many messages. Maintain social distancing. Stay home. Stay 6 feet apart. Quarantine for 2 weeks. Stay within your bubble. Self isolate. Let's meet on Zoom to hang out. The fact that the messages and guidelines are often changing has added to the uncertainty we are navigating. While keeping physically distant from others has been essential to prevent the spread of COVID 19, at the same time, these safety measures has also resulted in social isolation. We are social beings. We need connection to survive and thrive. Isolating is very hard, and we know it has had a significant impact on our mental, emotional, and physical health. For some, all of the change and uncertainty has led to social anxiety, a sense of disconnection, loneliness, and sadness. Depression and anxiety can affect our sleep and activity level and cause us to act out in ways that are new and distressing for us. Some people become angry or irritable, which impacts others as well as their own health. So, what can we do to get through this challenging time? Keep busy. Ask if your employer will allow you to work from home. Stick as much as you can to your schedule for work, leisure, chores, meals, physical activities, and sleep. Think of social activities you like to do and set realistic social goals to carry out plans safely. Be creative. Consider different ways of connecting with others, such as using technology to connect with family and friends, hanging out in your front yard and interacting with neighbors, planning a small gathering outside at a safe distance and location. Make self care a priority. Focus on activities that you enjoy. Practice relaxation, stay physically active, and have healthy meals. Maintain spiritual practices that are important to your well being. Planning ahead rather than leaving activities up to chance increases the likelihood of follow through and having helpful safety measures in place. It also ensures we have the basic things we need, such as food, medication, and personal care items on hand. As we mentioned earlier, social distancing is hard work. Sometimes we are so busy dealing with life and caring for others around us that we forget to prioritize ourselves and our own well being. We might feel we don't have time or energy for self care. Investing in ourselves through self care helps us as we get through life's challenges. Here are two videos that offer suggestions for self care and how these practices can help. Both videos are available on YouTube by searching the links listed below. Thank you for taking the time to watch this module. Please visit the additional resources and videos for further information.